Hello. Thank you so much for the opportunity to share our work today. I'm Grace Lee from Duke University Medical Center, and our abstract is entitled Evaluation of a Point-of-Care Device for Reducing Patient Wait Times in Blood Transfusion for Hemoglobin Disorders. As everyone in the audience knows, red cell exchange is an important part of therapy for many patients with sickle cell disease. The goal of red cell exchange is to efficiently and rapidly remove sickle red blood cells while simultaneously replacing and transfusing healthy donor AA red cells. Apheresis instruments are able to precisely attain a post-procedure hemoglobin S level based on calculating a target fraction of cells remaining, or an FCR. The FCR is the percentage of starting defective red cells that will remain in the patient at the end of the procedure. The apheresis instruments calculate an FCR by dividing the target defective red cells by the starting defective red cells. Precise achievement of a target hemoglobin S level post-red cell exchange can only be achieved by knowing the starting percentage of defective red cells. Many, if not most, apheresis centers do not have hemoglobin fractionation results pre-procedure, so apheresis centers use multiple strategies to circumvent the lack of real-time results. Some apheresis centers use historical results to plan their current red cell exchange. There are many mathematical strategies that are out there that allow us to try to predict pre-red cell exchange hemoglobin S levels. And sometimes we ask patients to come in well in advance of red cell exchange so that lab results and hemoglobin fractionation results will be available by the time red cell exchange is performed. Immediate point of care hemoglobin quantitation could facilitate timely and precise performance of red cell exchange. Availability of immediate point of care hemoglobin quantitation results could also be used to ensure that therapeutic targets have been attained post red cell exchange. The objective of our study was to compare hemoglobin fractionation results from a new point-of-care hemoglobin quantitation device to results obtained from our standard clinical lab instrument using samples collected before and after red cell exchange. For this study, we obtained IRB approval and informed consent, and then collected samples from patients with sickle cell disease who underwent red cell exchange at the Duke University Medical Center Apheresis Clinic. Per routine, all of their samples were collected before and after red cell exchange for hemoglobin electrophoresis on our university Sebia analyzer. After these routine tests were completed, we collected their discarded samples and then analyzed them on the Gazelle hemoglobin variant point-of-care instrument. Results from the Sebia and the Gazelle were then compared using the Pearson's correlation coefficient. So for those of you who are not familiar, the Gazelle hemoglobin variant point-of-care test is depicted here. This device allows for very quick turnaround time and allows hemoglobin fractionation results to be obtained within less than 10 minutes. The device is extremely easy to use. All of the reagents are stored at room temperature. It uses a very, very small amount of sample, just 20 microliters, which would allow potentially for finger stick samples to be used. Prior studies from Gazelle have also shown that it's very accurate and it correlates well with HPLC and capillary electrophoresis. It also is able to connect to potentially an electronic health record system, and it is a true point of care device. It's very small, it has a small footprint, it is portable, it's battery operated, so you could take it potentially to the bedside. So over an approximate 3-month period, we were able to collect 100 samples from patients before and after red cell exchange for our analysis. These samples were collected from a total of 23 individual patients. Many of these were on chronic red cell exchange, so they came multiple times during the 3-month period. We ended up collecting samples from 18 patients with genotype SS, 3 patients with SC, and 2 patients with S beta null. These are the results from our study. On the left-hand figure are hemoglobin A results, and on the right-hand figure are hemoglobin S results. In these figures, the Sebia capillary electrophoresis results are plotted on the x-axis, and the results that we obtained on the Gazelle are plotted on the y-axis. You can see on the left-hand graph that hemoglobin A correlated very well between the Gazelle and the Sebia with a Pearson correlation coefficient of 0.979. And on the right-hand graph, the Sebia and the Gazelle again correlated very well in terms of hemoglobin S results with a Pearson correlation coefficient of 0.981. In summary, the Gazelle hemoglobin point of care data was highly correlated with results obtained from our central lab using traditional capillary electrophoresis. The ability to obtain accurate immediate hemoglobin fractionation data may improve apheresis care for patients with sickle cell disease. You could imagine that accurate calculation of an FCR may lead to improved ability to reach target hemoglobin S levels. You could also imagine that if you were able to obtain an immediate hemoglobin fractionation result after red cell exchange was completed, this maybe could facilitate the ability for us to ensure that therapeutic targets are reached in real time. This is sometimes really important for patients who are receiving a red cell exchange preoperatively or before gene therapy or before undergoing conditioning therapy for hematopoietic stem cell treatment. Also, although we did not analyze this, you could envision that it's possible that a point of care device could possibly decrease red cell requirements. This would have important implications for donor exposure and potentially the risk of alloimmunization. And also, just from a practical standpoint, it could have a possible impact on blood and resource utilization. I wanted to take a moment to recognize that the study and the results shown today were a group effort from the Duke team led by Kimmy Boyle, my research technician, as well as myself and Dr. Marilyn Tellen. I also wanted to take a moment to acknowledge and thank the Hemex Health team for providing us with the Gazelle and the reagents to complete this work. Thank you.